Episode of Mom Strength. I'm your host, Surabhi Veitch, and I'm so excited to have on today Dr. UC Ossai, who you may know from the Instagram worlds as UC Logic. Dr. UC is a pelvic PT, sex counselor, assistant professor in Salt Lake City in Utah, and honestly, a general badass. And I'm so excited to have you on here today.
Thank you for having me. I am just elated, happy to be here, very happy to be here.
So tell me a little bit about what got you into the world of sex education, sex counseling. Pelvic PT is such a broad field and you can go so many
Sure.
directions. So what brought you into that interest?
Well, I was lucky enough when I graduated physiotherapy school, PT school, to have been accepted into a residency program for pelvic health. At the time, it was called Women's Health Residency, but it's evolved. But at WashU, so I was at Washington University at St. Louis, which is one of the top programs in the U.S. for PT, and they had some serious superhumans leading the charge, Dr. Tracy or Dr. Teresa Spitznagel, Dr. Tracy Spitznagel, and Dr. Stacy Tilka and Dr. Brooke Kalisiak. They were my mentors. And so during that year, I was seeing patients, mind you, across the gender spectrum.
Yeah.
So it was just all over. And even though my job was to learn to be like a pelvic health expert, there were so many sexual issues that kept coming up.
Yeah.
And remember, I was green as could be, brand spanking new, right? I still had breast milk on my mouth from PT school, right? I was just trying to learn. And I will never forget, I had a patient, he was, he was doing post-prostatectomy rehab for his incontinence. And he was asking me all these questions about his erectile function, his sexual function. And I just didn't, I had
Couldn't
like
answer them.
yeah, I couldn't answer them, at least with confidence.
Yeah.
And I felt like so devastated by my lack of knowledge. And I remember I asked a colleague that we sat next to each other, and he identified as a male, and I asked him all these questions. He was like, I actually don't know. And so that became my journey. It was, that I think it wasn't just him. I think he was just the straw, that
Yeah.
patient was the straw out of all of the patients that I couldn't really
You couldn't
answer.
help. Yeah.
Right. And here I am in this residency program, right? And
Right.
the residency program was excellent by far, but one of the things that I think when you think about all graduate healthcare education, whether you're talking about nursing, physical therapy, occupational therapy, medicine, they don't do they don't center sex education
No.
as
It's like an
part of it.
afterthought.
Yeah, it's an
If at all. Yeah.
right? And it's not, they don't teach it, even though we know it's central to one's health, they don't teach it as such. Because the concept of sex is so wrapped up in a lot of cultural, societal expectations, norms, and power struggles and dynamics. So that's what actually got me going on my path to becoming what I've become today.
That's incredible. And I feel like early on in my career, actually my first job, my first year, I remember treating a man with discogenic back pain. And I wasn't in pelvic health, I was in orthopedics. And he, I was helped him, he was doing better. And then he kind of started really feeling awkward, asking me this question. And he actually started crying in this session, like a grown adult male, which you rarely see. It's not normalized in our society to let men express their emotions. And he was crying during this session because intimacy was so important to him and his wife. And he was like, I'm not able to participate in, be intimate with my wife. Like, can you help me with some tips? And listen, I grew up in a conservative Hindu home. So I was just like, same thing. I was vanilla. I was like, okay. And so there was this book in our clinic called Sex Ed or Sex Positions or something, specifically for people with back pain. And so I photocopied right?
Love it.
Photocopied these pages, put them in an envelope, and just gave it to him.
Yeah.
I couldn't even like talk about it back then.
Right.
And he came back the next visit and he was like, thank you so much. Like, that was so helpful. You've helped me more than anyone. And I'm thinking, all I did was photocopy some pages for you and
Yep.
like taught you a few alternate positions because,
Yep.
as the patient, you often can't think clearly when you're in pain either, or when it's happening to your body. So, that was my first taste of, well, I better learn more about this because I'm going to keep getting these questions. And not only is it embarrassing not having an answer, but you're also like, I can't help this person. And that feels wrong. Like, our job is to help people, right? So
100%.
I love that it came that way for you. Okay, so tell me a little bit about some myths that people have around sexuality in long-term relationships. Um, Both heterosexual, cisgender relationships, or queer relationships, just in general.
Yeah, I think that, let's start with the concept of orgasms, right? And I think that I think one of the myths, and I brought this up in one of my Instagram posts, is like I'm supposed to orgasm at the same time as my partner, right? So can
Rarely
we
happens.
can we unpack that? Like that is a very real complaint that I have gotten over the years, still get, is like, why can't we simultaneously experience our pleasure?
Right.
And I always do some wordplay. And I said, you actually are simultaneously experiencing pleasure.
Ah,
You are. The
yeah,
experience of sexual play and engagement and anticipation and touch, you are simultaneously experiencing pleasure.
yeah,
So the orgasm, the climax, is not the pleasure czar. Like it's not in charge of your
yeah.
pleasure. It's just a byproduct
Of experiencing.
of experimentation, of sexual experimentation and touch.
Wow.
Right? And so when we think about the concept of this needs to be the same, it's not taking into account a person's individual sexual self, right? If you and I were married, you would have your own sexual self. I have my sexual self. And we bring that together in our marriage or in our relationship. And we create something that informs us both. So what my sexual self stuff, right? My stuff, my interests, the things that interest me, the things that don't interest me, aren't necessarily going to be the things that interest you or don't interest you. But you
Right.
find a sexual space together. And so oftentimes the antidote or the solvent to the answer to this distress is to kind of rework people's expectations,
Right.
right? And to think about the concept of just the goal-oriented sex and how
The
we can
checkbox. Oh,
the checkbox.
orgasm
Yeah,
achieved, done.
yeah. How we're managing that idea of sex.
Right.
Because what is the simultaneous orgasm was a kind of a false construct, right? It's not even saying like I might have an orgasm at the same time as my partner. It doesn't mean that it's a pleasurable orgasm
Yeah. Doesn't
because
mean it's the
yeah,
best,
yeah,
way it's supposed to happen.
absolutely. Absolutely. It
Yeah.
doesn't mean that we are any more, depending on like how you want that sexual experience to be. If you're looking for intimacy, sometimes with the orgasm, depending on the relationship, after you orgasm, the intimacy disappears. Like there's no connection, right? It's almost like puts people further apart depending on the context of the situation. For
Right.
some people, the orgasm or the experience or the pleasure brings them together, but I challenge people to think of the orgasm as you would as one of the things that experiences in life, like one of the things you see on a walk and a hike, right?
Yeah.
I might see the river, I might see an oak tree, I might see a spring or a
Yeah.
red, right?
It's
Like
not the top of the mountain.
it's not the top of the
It's not the
mountain.
views from the top. It's
It's
just
not the
another thing that you might see on the hike.
exactly, exactly. And so when we do that, and you say, how do we experience mutual pleasure? Let's play together and
Mm.
luxuriate in that
Oh,
mutual
that's a good word.
play, right? And
Yeah.
just be all yummy, yummy in that play, whatever that play looks like,
Yes.
right? That's the juice.
Yes.
The juice.
And I think that for that to happen, we have to get, we have to communicate with our partners, because I think so often we fall into these ruts of this is what our sex looks like. Our sex finishes in orgasm. This means sex is done, because sex doesn't have to finish at orgasm. It can finish at any time.
At any time. And
There's no like end goal. Okay, now we've had sex because we've both orgasmed. And I feel like going back to what you've just said is, working that framework of like, it's not about goal oriented sex. It's not about another checkbox. It's about experiencing pleasure together. And the first thing you said is you are both experiencing pleasure. And I think we forget that our partner, even if it's just our partner experiencing orgasm, if we're in an intimate relationship that's, with consent and someone you are excited about, you also experience pleasure when they experience pleasure. And we can't forget about that part.
absolutely. And can I also speak to the individuals who are having sex, but they're not totally into having sex, and they're having sex
Mm.
because they're like, you know what,
They're
it's
told that's what, yeah.
yeah, or they feel obligated. I just want to also say, like, listen, there are many reasons to have sex.
Right.
And as long as you're consensual, as long as you're okay with those reasons, we can all, like, everyone can take several seats.
Right.
Judge, right? So I
Right.
don't want to prioritize pleasure, sex. Because sometimes people have sex for power. People have sex to kind of keep their partner like less cranky. I get it, right? Like,
Yeah.
there are multiple reasons. We can hold space for all of the reasons. And so, however you want to engage in that, and we have to understand that there are multiple reasons, because when people ask me these questions,
Yeah.
and I do have to ask, well, what is sex for? Right? My colleague, Heather
Right.
Edwards, brilliant, brilliant human being, brilliant sex counselor, educator, Edwards Creations. Heather Edwards has this great workbook for her clients that says, what is sex for? What is sex for? And I ask that of my clients. I say, what is sex for you? And it can be multiple reasons.
Could be many reasons.
Many. Stress management. Listen, you might be like, I'm so stressed out. I need boo boo to come home quickly, right? Because I'm in the mood for partnered sex
Yes.
and I need that release,
That release.
right?
Yep.
And that's where sometimes people say, well, I need that orgasm for release. And then I say the same thing. I say, if we're using this as an anxiety solve or bomb, right? Then we want to think about, okay, this whole experience and how it's just kind of soothing your anxiety, and like kind of the process of chasing your pleasure and experimenting your pleasure is a way to build out your anxiety.
Mm.
And it could be that the type of sex you engage in might be like the sex you engage
Different
in.
type of,
Exactly, different type of play.
yes.
Right? If you're feeling anxious because you're feeling powerless, and then you actually feel like you want to have a sexual encounter where you're the captain, right? Where you're in
Yes.
charge, right? You can say, okay, sweetheart, like it could be something simple as like you can text and be like, I need you when you get home to take those shoes off, right? Get up,
Yes.
be dressed in these boxer briefs that I love,
Yeah. Yeah.
or this thong that I love, or
Yes.
whatever,
Yeah.
and be on the bed, and I'll be there in 15 minutes. But I want you to stay put.
Listen, whoever listening to this, if you've had a bad day, you've got rejected, something, you tried for something, didn't happen. This is a great idea, because I don't think people we think about sex for pleasure, or obviously, making babies. Like, it's so cut and dry, but there are all of these other reasons for sex in between. Sometimes it's comfort, sometimes it helps with emotional connection. And some people are very into needing physical touch to feel secure in a relationship. Anxiety, sleep, like as we enter that perimenopausal state, listen, I can use all the help I can get with sleep. So
All the help. All the help.
all the help.
All the help. Same, right? And And it could be that I want everyone to think of sex as like you can create scenes that
Mm.
serve you. You can create scenes that serve your partner, right? If that brings you joy, because sometimes you don't have to actually touch. You can watch. You can read to each other. You can
Mm.
listen to erotic sexual storytelling. You can, like, there are lots of ways to be in that sexual energy and space. But I have to say something, I'm going to say something controversial. A lot of us, when we have sex, we're not really present.
No.
I mean, that's not necessarily controversial, but I really want you to think about the last time you had sex, how present were you in what you were feeling, experiencing, and doing? How present were you?
I mean, there's a lot of for me anyways, as a mom of two kids, there's a lot of mental distraction that I never had an issue with before. And it's learning to, this is why I actually really, not that specific reason, but that's one of the main reasons I started my mindfulness practice outside of sex, because it actually helped me be more mindful and present during sex.
Right.
Because there's so many points in our day we mentally check out because we're drained, we're exhausted, and there's always something going on in the background of your to-do list. And if you're not actually present for sex or for that sexual experience, you're not experiencing what you need. You're not getting that stress relief. You're not getting that pleasure. Even if it's the best oral sex you've had and your partner is doing all the right things. Because there'd be times where I'm like, he's doing all the right things, but I'm not feeling it. I'm just
Feeling
like
it.
not here. And because that's what sometimes people will say, my vagina, everything feels numb. And I'm like,
Right.
is it true numbness? Like you cannot feel numb? Or is it that like you're not feeling the pleasure you're expecting to feel that you used to feel? And how much of that is, in your brain?
Right. Right. Oh, I mean, I think that that's so perfect when we think about also the way that our brains are functioning as we go through the life cycle.
Mm,
What's impacting what? Right?
right.
If we are perimenopausal brain, if we have menopause brain, if we have postpartum brain, pregnant brain, post cancer treatment brain, we have, hey, like everything's healthy brain, but I'm going through a transition in life where I'm going from a manager to the CEO, or I'm
Mhm.
starting a business, or I'm taking care of an aging parent. Like there are so many pieces of our brain and our hormones and the neurotransmitters that are going to impact that. And so one of the things that I was talking to a friend of mine the other day, and I said, I feel so lucky in what I do because the way that I think about sex is there's like it's just really open.
Yeah. You have
I
a
don't
very
have,
broad,
yeah, I don't have
not
this,
limited, narrow view of it.
nope, nope. But did that come yesterday?
That's what I was going to ask. Was that always the
No,
case for you? Because some people
no.
you just see they're like naturally more sexual. Listen.
Listen, that is a great question and a great point. And I do like if you ask my sister, because I'm the baby and my sister's the oldest. I
Yeah.
mean, we're only 18 months apart, but
Oh, cute.
when I introduced her to my friend or people, I'm like, this is my much older sister, and she really hates it. But definitely like much more reserved than I am. I'm just, but she will say, like, you see, you've always been a little like, hey, like I'm
Yeah.
here. And I think I've always been open-minded, but I not when it comes to sex, I think I was always curious. Like I was like, huh,
Mm,
like what is that? What does that mean? Um, but I will tell you this, like I always felt comfortable expressing my curiosity, but my sister didn't. And
mm. Growing up in the same household.
we grew up in the same household. So I will say like there are parts of the individual person that may feel more comfortable and depending on how we see the world. Like we're both Black women,
Yeah.
right? Let me clarify, we're both cisgender,
Hmm.
heterosexual Black women. But we express ourselves and think about sex completely differently with the same parenting.
And despite being like pretty close in age, it's not like
Yeah,
you were like 10 years apart and grew up in a different generation. Like you grew up together. And And that's something that's important because I think so much of it is we are different people innately.
Mhm.
And so for some people it comes easier. But I think that just like language, you can learn it at any point. You know, it might take a little bit more work for some people. Like for me, I never if if I look at my who I am as an individual without the way I was raised, I don't think I would have any trouble speaking and
Right.
asking for my needs. But because I was socialized as, to be a good little South Indian girl, quiet, meek. That was my persona for a long time until I was like, wait, like who am I outside of like my rigid expectations that my parents put on me? I remember dating a guy and it was early on in our relationship and he was like, just so you know, like I'm a very sexual person. And I panicked. I was like, what does that mean? Like, I don't even understand. I don't even understand what that means because I had such a narrow view of what sex is and should be. And I panicked because I didn't know what that actually meant.
Right.
And I think it's important that we don't judge ourselves if that's us, because it's all about what exposure you've had, who you've been around, the learning you've done, the conversations you're having. Um, and I think that what I love about you and your education is never judgy. You never feel like, this person is looking down on me because I have these views or I have these insecurities. And I think that as somebody who's a sex counselor, pelvic PT, like what a gift to your clients, the people that you work with, and the people you educate, because it's both. You help educators also unlearn their shame around it because just because we're educators and pelvic PTs doesn't mean that we're not bringing our own baggage into it, right?
Right. Right. I think, and that's a number, I think that's the number one thing. You know, I was talking with, Dr. Kelly Casperson this past weekend because it was South by Southwest, and she was speaking on a panel. And she's been a friend of mine for a long time, um, and she was saying, or we were kind of speaking on it, and the point of people need to understand that we are individuals going into this healthcare space.
Mm-hmm.
Just because we're providers, we don't know all. And the same things that our patients are struggling with, we are struggling with. And as for me, that I provided, I was, professor in graduate medical education for, 10 years. I think that was the main piece that I started them with. I said, listen, you all do not need to, you know, adopt new values. You don't need to change who you are. You just need to know where you are.
Right.
You just need to know where you are and what your comfort level is. And I would always say to the med students and our residents and our fellows, your patients want you to bring this up.
Mm.
Patients want you to bring
They're
up this.
hoping you bring it up so they don't
They
have to
want you to bring it up.
awkwardly. Yes.
86% of patients want their provider to bring it up.
Mm.
Right. And the
Wow.
fear that the provider has is they don't want to make the patient uncomfortable. They don't want to cross a boundary. They don't want to disrespect the patient. They don't want to seem like a creep. Those are legitimate things they say
Yeah,
because
fair.
they don't have the skills to navigate it. And I'm like,
Right.
you don't need to know all the answers, but
Yeah.
what you do need to know is what's in your community, what's in your
Right.
patient's
Who can you
community,
refer them
who
to?
you can, and validate them by saying, I hear you, right? Like we got 7 minutes,
Yeah.
right? And it's always at the end where,
It's like an afterthought. By the
right?
way, sex really hurts. Is
By the
that just
way,
normal?
right? And that's what I tell them, ask all these questions. Say, okay, I hear you. We're not going to be able to address that in the 30 seconds we have left. But
Yes.
here's this great website, or here's this great Instagram account, or here's this great book. I want you to look into this during the time that you go see this other referred provider that I'm sending you to.
Yes.
Let's get you started. So in that encounter, they're validating the patient, they're giving them a resource, and the patient has direction. That you did not have to reveal yourself. You did not have to like go into the politics of it. You did not have to, all you had to do is listen to their concerns, validate it with the referral, and give them a resource that they can educate themselves further on.
It was like that handout that I gave my client. I was
Yep.
like, I don't feel ready to
Exactly.
educate, but you know what? There is a whole book that we have in clinic.
Exactly.
And I was shocked at how much it helped him, but it clearly provided him with the resources he needed at that time.
Exactly. And I think that people think it needs to be much more complicated than it
Yeah.
is. And it don't get me wrong, and I don't want to poo-poo the complicated, it is complicated, but I think when you're the first touch point,
Yes. Keep it
like what you
simple.
did was beautiful. And it made such an impact.
It really did. Like I remember that moment. I remember that moment, you know? And I also think that often when somebody has any type of sexual pain, especially as vulva owners, there's a lot of stigma and shame associated with it. I'm sure it's the same. I don't work with men mostly. I work with women and vulva owners. So erectile dysfunction. There's a lot of shame associated with these types of diagnoses and dysfunctions or situations. And I really think when we talk about it more openly, or when we even ask, how is in my form, my intake form, is there anything you'd like to share about your sexual health or wellness? How is your pleasure? Has it changed after having a baby? Like certain, guiding questions. It opens up those conversations because people are more likely going to write it down to an, computer screen than actually share that face to face. And especially I find my women of color, Asian, Indian women, like who are very, we don't talk about this in our house. And it's important because many people are having sex. It's not uncommon. Like a lot of people are doing it. And there's a lot of people experiencing discomfort or not the pleasure, not the goals, not, I don't even like using the word goal, but they're not getting from it what they actually need.
Absolutely. Absolutely. I mean, there's and the cultural piece of it is always there for me, right? It's always there for me. I look at all of my patients through an intersectional lens.
Yes. Can you
Inter-
talk a little bit more about that? Because for me, of course, I know what intersectional lens means, but there might be some people who PTs, professionals who are hearing this in relation to PT for the first time. How does that relate?
So, like what I always tell people is that intersectionality is a way to look at how power intersects how we live our lives, right? How we access power, how we access resources. It's a way that, when you're thinking about, for example, I am first generation American. My parents were white collar workers, right? But we were lower middle class, right? We weren't upper class. So from a class standpoint, right, there's a resource allocation for people who are rich and wealthy versus the lower middle class or poor, right?
Mm-hmm.
There's a difference between, even in my microculture of like Nigerian American, uh, or even Black America, right? They'll say, oh, you're coming to the States for college, or are
Mm,
you coming to States just to work, right?
yes.
There's a hierarchy. It's like, oh, okay, they're the chosen ones, right? And it's like, it's not even like that. But the way that resources are allocated, the way people get favored, the way people get treated, right?
Right.
You can look at it from a colorism standpoint, which can be under the umbrella of racism,
Yeah.
right? The lighter skinned you are, even if you're from India, from Asia, from Africa, right? You're going to be given different resources.
Yeah.
You're going to be more desirable from a romantic relationship. Your cardiovascular health risk is lower than someone who is darker skinned, right? And so when I talk about intersectionality, I'm looking at all of the components of our identities
Mm,
and how that impacts a person's health, their choice, their access, their experience in the world. I don't assume, but I'm looking at it
you're
from,
aware of it.
I'm aware of it. I don't make assumptions, but I'm
Yeah.
aware. It's very much there.
And there's some things that a person in front of you will share with you if you just are listening or maybe even ask the right questions. So I do think that most of us, if I'm the patient, I'm not even aware of my intersections and how that plays into whatever ailment I have. But you
Right.
as the provider is important to recognize that, this person is not going to come out and openly say that, because I am poor, this is why I struggle with it more than my wealthy friends. They're not going to come out and say it, but it's something that we need to be aware of because our treatment plan has to, it's going to change depending on what their actual needs are.
Absolutely. And I think also too, like what we also need to remember is that intersectionality helps us make clinical decisions. It helps us look at our health situation or our health space with a more informed lens,
Hmm.
right? I always tell people that it's almost like an answer book to the test. It's like you have, or it's like a structure or like an algorithm to navigate some of the challenges that we have,
Yeah.
because it just gives us a little bit more insight.
It's not like what we learned in school. Like I remember in school, it's like, oh, females are more at risk of this injury. And you're like, wait, what? Why? And it's not all females, right? There's so much more than just trying to treat gender as binary, trying to treat it as just an age issue. You know, there's socioeconomic status, colorism, racism, neighborhood you grew up in. Do you have family support? Did you come here as an immigrant by yourself? You know, there's all of these layers. And I actually find that when I openly talk to my clients about some of these issues, they're like, oh, they feel seen. One of my clients has, you know, just vaginismus, and she was like, you're the first person to actually talk about like culture. And I'm like, culture is huge. And, you know, people have seen multiple pelvic PTs, and it's just like the topic of sex, how some practitioners might come into it with a bit of discomfort. Many practitioners have discomfort talking about culture or race. And so if you're uncomfortable with it, maybe referring to somebody who is more comfortable with it, doing your own like learning. You know, talk about you have a sex counseling program. Am I
Yeah.
right? Talk about that, because I know in that course you talk about the cultural and, you know,
Yeah.
intersections.
Absolutely. I just want to say one more thing about intersectionality, and I'll definitely go into it. Collins and Blige, they wrote a great book on intersectionality and health, and do a
Oh,
lot of
okay.
research on it. And they said this one thing. They said that people use intersectionality as an analytical tool. So an analytic tool to solve the problems that they or others around them face. So it gives you like a better access to the complexity in your world and the world of others around you. And so I really want people to resonate with that. So no one is a monolith. There are so many components to our identity. And
Yes.
culture is not for only people of color.
No, it's
Right?
not.
Culture is everything, right? Like, your culture is how you were raised. There is a microculture in the larger culture that I grew up with. There are so
Yeah.
many cultures. And that actually colors how we view ourselves and sex. But
The
yes,
culture of your household. Yeah.
the
Whether you
culture of
grew up
your
in a
household.
religious home,
Yes,
did you see your parents touch?
yes.
Did you have, you know, were you encouraged to hug each other? Like my parents, we never grew up hugging, kissing. And so, you know, it was like, oh, I'm thrust into dating life and adulthood, and I'm having to navigate all this myself. And let me tell you, it's really, I think that's why I really have empathy for my clients who, you know, maybe coming from similar backgrounds, because it is hard. There's a
Yeah,
lot of unlearning.
absolutely.
And but it's such beautiful work because hey, it opens up your life to more pleasure, sexual pleasure, and outside of sexual pleasure too.
100%.
um
100%.
so talk about, yeah, I want to hear more about your sex counseling
Yeah.
certificate program.
So Heather Edwards and I, we created the Pelvic Health Sexuality Counseling Certificate Program. So it's a 3-month program for anyone who takes care of a pelvis. So PTs, MDs, OTs, PTAs, physician assistants, nurses, you name it. We developed it for people who want to develop more advanced clinical skill in sexual counseling and education. And what we've done is we've created it from a framework that is rooted in intersectionality and social justice. So we're not just talking about things just as like from just a gender binary or anything like that. We're really giving people the education and the skills to be able to have these conversations with more comfort. But we also intertwine and require that as we're educating you, you're doing the homework on yourselves first. So we
Yes.
want people to be working on themselves first in their comfort level. And it's very revealing. I
Yeah.
mean, it's a very, it's only 3 months, right? But like, we all
It's
busy,
concentrated.
but
Yeah.
it's
Yeah.
concentrated, right? So it's 40 hours of content. So we have, weekly office hours that are live, but they watch pre-recorded content, they get handouts, all of that. But we guide everyone through the content together in that cohort. And
Amazing.
we have a common language in terms of sex and sexuality, and listen, I tell people all the time, even though I present like super chill, I'm very much like, you know, type, like I'm very, very hard on myself, right? And I wish it was more comprehensive, but like, what can you can't teach everything about sex in 40 hours, right?
No, yeah.
Um, so we did the best that we could in selecting topics and subjects, but we talk about power dynamics. We talk about sex work. We talk about sex medicine. We talk about sex and aging and
Mm,
pregnancy. And we talk about, how the history of sex, the sexological work, and what culture and the impact of minority stress and how
yes.
that plays into and sexual scripting and cultural stereotypes and how that kind of chips away at our sexual creativity, how that chips away at our humanity, our sexual humanity. And
Yes.
so we're really proud of it. We're a year in, we're on our fourth cohort
That's
now.
incredible.
It's exciting. Yeah.
And it's exciting coming from the perspective of a pelvic PT
Mhm.
who understands the physical aspect of it as well as the mental, spiritual, psychological, all of those other aspects of sexual wellness as well. Can you talk about some elements of pleasure that people don't explore enough? Um, we know P and V sex is very, very taught to us. Movies, TV shows, porn, it's all about P and V, but what are some areas that people can explore outside of that?
So, I always tell people that pleasure, we have to first give ourselves permission to experience pleasure. So that's the first thing that I work on with my clients. Are you really giving yourself permission?
Mm,
Are you really? And then and I always say, we use the term unlearning a lot. And I think it's not necessarily about unlearning, it's about creating space for new learning.
mm,
Because unlearning kind of puts, depending on the person, but for the most part, I try to say, let's just create space for new opportunities.
mm.
Let's create space where we can think about sex and pleasure in different ways, you know? Because when people talk about sex, sometimes they'll say, so one of the first things we do in the program is we get the definitions out because someone will say intimacy. And I'm like, okay, do you mean intimacy like extreme emotional closeness?
Mm.
Right? Or
Yeah,
do you mean sex, like the act of sex?
yes, because those are two different
Intercourse.
things.
Do you want vulnerability? Do you want interconnection? Right? So kind of, I think for some of the first steps is just being honest with yourself
Yeah.
about what you want. Is it that you want the act of sex? Is it that you want to be touched externally, internally? You're not sure. You just want to be touched, right? Or do you want that personal connection? Right. And then that's when I say this is when you can, kind of bust out the ideas of pleasure and that, okay, let's start with sensuality, right?
Mm.
Sensuality is the experience of the senses.
That's like the whole Kama Sutra is the whole
Yes.
point is, people think it's just like a bunch of sex positions, but it's like the whole point is to explore the senses
Right.
and the sensuality of sex.
Right.
And it's
Right.
kind of cool that there were documents way back then talking
Uh-huh.
about this. And then you're like, wait, well, how come we haven't made progress? What's happened? And I mean, we know historically things have happened with colonization and, changing the way that indigenous learnings have been passed down and
Right.
interrupting that process. So suddenly we are just not going to talk about sex, just not going to learn about sex. And what we're learning from school is just reproduction.
Yes. Yes. And when you think about the concept of sensuality, like exploring the senses to like have that deep connection, to be lost in your sensations and your emotions and your feelings, and to like I'm going to bring back that word luxuriate.
Such a good word.
And it's not like, and people are like, well, because sometimes people get frustrated. So when I bring this up, people get frustrated. But like, no, but like, I need this because this is what sex is to me,
Right.
penetration.
Right.
And so I say, cool, cool. I'm not poo-pooing that, right? I'm not having you unlearn that.
You're just
What I
making
did
space for
there?
more.
Yeah, I'm just adding to this whole option of sex for you.
Yes.
Right? So because I don't tell people, you know what, that's the wrong way to look at sex. That's not helpful. That's just not helpful, everyone. It's not helpful to tell your patient or client, that's the wrong way to look at it,
Yeah, yeah, yeah.
right?
Yeah.
I don't tell my patients, oh, they should prioritize outer course, right?
Yeah.
Especially like my heterosexual patients. I don't say that, or my patients who primarily engage in penetrative sex, right? Because not all heterosexual individuals engage in penetrative sex. I don't think of sex in that space.
Yeah.
I don't assume. I just say, let's add to this. Like, let's add to the sensation. Let's bring in our awareness, right? You can use the concepts of mindfulness, you can use sensuality, right?
I think of this in terms of cooking. When you learn to cook, you might know like 2 or 3 dishes, and that's like
Mhm.
your repertoire. And you might really like those dishes, but that doesn't mean you can't learn new dishes and that you realize, hey, I actually really like this too. Or you try something, you're like, that was a fail. And we don't judge ourselves in the kitchen quite as much as we do in the bedroom. So when we
Absolutely.
try something and like that didn't go well, we internalize that
Mhm.
instead of realizing, well, it's just another recipe that or another thing that I'm creating and exploring, right? Um, and for me, I like that. I think in analogies a lot, and I think that that's one of the powerful analogies. Is like we all eat every day.
Mhm.
We all. It's very commonplace for us to have like favorite foods and this and that, and we can confidently say like, I love chocolate chip cookies. Like that's my favorite dessert. But then when it comes to sex, we struggle to say what is your favorite. What do you like? What do you not like? um and communicating with your partner. I think what you're saying is like it's you first, right? It's like
It
you
is.
first before you then start adding on that interaction with your partner or partners.
Absolutely. And when I tell people to think about what they're trying to feel first before we think about other ideas of pleasure, because sometimes we chase difference for the sake
Mm,
of difference.
yeah.
We chase novelty for the sake of novelty without actually understanding
Why?
what we're craving to connect with, because then it falls flat. It's kind of like when people ask me like, what's the best sex toy? Like I did a Bourbon Tales last week about it because it's like, I don't know.
So individual.
I don't know. What are you looking to feel?
Yeah.
Right? Because they may think I'm going to suggest a vibrator. I'd be like, no, you just need some nipple clamps.
Yeah.
And you don't need to put them on your nipples. You just might like the experience of like that tension, that pinch,
Yeah.
right? You might like to be restrained, right? You might like the process of feeling the restraint. You might like shibari or rope. You might like playing with power dynamics, right? That alone is very kind of interesting, right? You're saying, oh, I
Mm,
love for my partner to dominate, right? Because sometimes people say, I want my partner to initiate. Do you want your partner to initiate?
mm,
Or is it that you want to play with dynamics?
yes.
You actually want to be in control, but you want them to initiate in a way that, like kind of deep diving into that a little bit, because
Yeah.
you can explore pleasure through cooking, through art, through music.
Yes.
You can explore it through playing with power dynamics. You can explore it through restraint. You can explore it through playing with just different types of play.
It's just a adult playground.
Just an adult playground.
It's an adult playground.
The freedom that you see children playing because they're just like, this is fun.
Yeah. They just do it because it's fun.
And you can just say, let me explore it because I'm interested, I'm curious, because I don't really know what feels good. I don't know what I like. So I'm just gonna play with this because I'm curious.
Yeah.
And it may not be for you, or it may be for you.
I love that. Um, can I ask you a few questions about you? And what do you do to take care of yourself every day? Because I know you're a busy woman. Listen, and also being a Black woman in academia,
Uh,
in this space, talking openly about sexual health and intersectionality with sexual health. What do you do to take care of yourself? What are some like simple things?
you know, that is a very good question. I wax and wane in terms of my effectiveness
Fair enough.
in implementing some of these strategies, but I think the number one thing for me is travel. Uh,
Love that.
I'm always traveling. I'm always on a plane, and I enjoy exploring those spaces or new spaces or familiar spaces that I know are safe, and have people that I know love me and I'm around my ride or dies,
Yeah.
I think that's important. I think one practice is, you know, if from a business standpoint, right? One of the best advices I've been given was to have a board of directors, and not just like about my business, but just have people around you to advise you. And I think
Mm,
identifying those people in my life who I know can kind of be my buffer, be
yeah.
my support.
Help you be your sounding board and give
Yes,
you feedback.
yes.
That's such good advice.
I think that like I have, and some people say like some because like you have different friends for different purposes, right? I
Yeah.
have a friend that I call, my Megan, she'll be fine. My best friend Megan, we've been friends since we were 15, and she just has this blind loyalty to me. And it's so refreshing because no matter what, right? 3 kids later, marriage, she's still blindly like
I
if
love
something
that.
happens, she's like, I don't like that person. They're dead to me.
I I those are
Cancel.
the types of friends you need who are
And
by
she
you 100%.
100%. Like she's so funny to me because it's just like I'll tell her about something and she completely cannot focus on what I'm actually talking about. She's upset that at the
She's upset
person
for you.
for me, and she's like that they're dead to me. Do I need to come down there? So like I think that's a practice of like having people around you that will
your
always back you up.
your community who are like there for
Yeah.
you.
Yeah, I spend time in those spaces. And then I also spend time in spaces where like culturally, like spaces where I have the same culture,
Yeah.
like
Yeah.
my like Nigerian friends, like my, because like we're the first gen Nigerian crew, which is like
That's
a
awesome.
whole different.
Yeah. Totally different than being an immigrant.
Yeah,
Yeah.
it's so weird because it's like you're almost like this snowflake Nigerian because you were and like the way our parents raised us like these 80s babies, right?
Yeah.
Um and there is a solve for that. But I mean, if I were to give people advice who are in those spaces who kind of feel marginalized or feel different, it is hard.
It is hard. Yeah.
It is harder.
It is hard. And
It is isolating.
I appreciate you saying that because so often we think we're doing it wrong because we feel certain ways, but it's just factually it is harder. And that's why leaning on community is even more important. And so I'm happy to hear you saying that. And travel, especially traveling to places where, you're with people of the global majority and, it's different being it's different being in certain spaces.
Absolutely. And I think another thing, one last thing I'll say about that is I think I also go to conferences where there are no physical therapists.
Oh, okay.
There are no, like, I go to tech conferences, I go to conferences where my other parts of my brain are stimulated.
Yeah. So it's not
And
just all concentrated on, pelvic
yeah,
health, pelvic health.
Because I think that there's something freeing about being like this, the singular person who like, they're like, why is this physical therapist at this tech conference? You know,
Yeah.
and but you have really, you meet other people, and I think that engages your brain, and it engages an openness
Yes.
that I think is actually quite fresh and quite reparative,
Mm.
because it is truly a collaborative space. So I always tell people, if you could put yourself outside of like, out of like, even just if you kind of have a multidisciplinary approach to your life and career,
Yeah.
I think that that is a great buffer. Um,
I
but
think too early in our careers, my career anyway, it was all about PT.
yeah,
Every course, every weekend, just surrounded by it. And you kind of get sick of each other after a while. You're like, wait, like I need different. And generally speaking, PTs are, type A or really academic and really competitive, insecure, anxious, right? Like, just generalizing, but and being around that all the time can be really hard.
it's a lot.
My best PT friends, and we've all fallen out of touch because we've all found our little other communities, which, and whenever we get together, it's great, it's fine, but we also need our own separate identities. um what's something you're really passionate about right now?
Oh,
Could
oh
be
God.
anything.
Um, Perimenopause and menopause. It's I'm fully grown, I'm 41, and I think that I'm really, I'm really passionate about that right now. I'm really passionate about understanding that, particularly for people of color.
Mm.
And um I really, that's really what I'm really passionate about. I'm also really passionate about the premiere of Bridgerton in the summer. I'm a little upset.
I'm so excited.
I'm so upset that they are just doing us like this. Like it's been a year. Well,
We
it'll
don't have
be
to wait for so
a half,
long.
so long.
That's
So
insane.
I'm in my feelings about it. I'm a little mad, but it's
It's
okay.
it's so good. I rewatched season 1 and 2 and Queen Charlotte recently.
Oh, I love Queen Charlotte.
Queen Charlotte, I actually liked
Oh,
Queen Charlotte the best. It
the
was
best.
so good,
So
so
good.
well done. The actors and
Oh my
it
God.
just the story. Oh, you just like you're pulled in.
You're pulled in. And why did I cry?
Oh,
Why did
I
I cry?
bawled.
I was
I
like,
bawled.
what is wrong with my eyeballs? Like, I cannot even. It was so good. So good. So yeah, I'm low-key obsessed with that. And I know you weren't expecting that answer, but
No, I
that's
wasn't. That's what I love. That's what I love about this question because I think it shows how diverse we are within ourselves, with our interests and our joys and our passions. You're a very passionate person. So I'm like, I know you're passionate about things. So
yeah.
um, tell me, how can people best connect with you? We talked about Instagram, UC Logic.
Yes, you can go to my website, www.uclogic.com, where you can find a bunch of resources, my book.
Amazing.
You can book a session with me if you want. You can access, if you want to participate in our program, if you're a healthcare provider, please do. We are
I will
accepting.
definitely share links for that. When does that start? When does the next cohort start?
The next cohort starts May 15th, but our applications end March 31st, but we're giving people a grace period into April.
Okay,
Yeah.
amazing.
Yeah.
And do you have any things coming up other than that? Anything you'd like to share? Any launches?
Well, just this next cohort, I'm heading to Singapore in June to speak at the International Urogynecology Association, which is
What?
sexual health.
You
So
are
that's
so cool.
no, no, I'm just a normal human being who
That's
just
what all the really cool people say.
nope. But yeah, no, and
I know.
just trucking along, just doing me.
Nice. If you could tell me one thing you could change about the world, what would that be?
I would like every human being in the world to always center each other's humanity
Mhm.
and protect each other with to really, really focus on the greater good versus what benefits us individually.
Individually. Yeah.
That I would really like that to happen.
And I think if we create those communities within our circles, hopefully that spreads. I come from a very community oriented culture, and then moving to Canada when I was 10 was like a shock because I was like, wait, everybody just cares about themselves. Okay, cool. So I love that. I love that. What would you say is your biggest strength?
My capacity for silliness. I have a very large capacity for silliness. I do. I mean, I just love being silly
I
and
love it.
I think that's one of my biggest strengths.
People
And
lose their silliness as they get older, and the
I
fact that
do.
you've retained it and nurtured it is huge.
They do. And I am fiercely loyal. Yeah.
Well, thank you so much for sharing this conversation with me today. You see, you are um, so full of wisdom, and you're also very nurturing in
Oh,
terms of not just the conversation, but I feel like you're a nurturer of communities and the impact that you have, even with your Instagram. People talk about it when we're not on Instagram. Like when I hang out with my pelvic PTs, we're like, hey, did you see the last Bourbon Tales? Like literally we talk about it. So I think that the impact that you have is bigger than you may even know. And I'm really grateful that people get to hear this conversation and learn from you. And go check out your sexuality counseling program, um, and your page and all of that stuff.
thank you so much. You are a gift to me. I'm so glad you're in my space, and I just can't wait for us to do more collabs in the
Me
future.
too. Me too. And hopefully we get to meet in person. Cause I'm like,
Yes,
have I met you in person? I'm like, I feel like I have, but I don't think we have.
right, right. I know.
Yes.
We haven't.
We
We have
haven't. It will happen. It will
will have.
happen. And I'm excited for a huge hug.
Yes.
All right, my friends, if you enjoyed this episode, share it with a friend, share it to your stories, tag us, let us know what you think. And thank you so much for staying till the end, and have a wonderful rest of your day.